It is a pleasure to have you with us in the Gluteobioplasty, Ultimate Brazilian Buttocks Augmentation online course. Before starting the class, let's get to know a little bit about the creator of the course, Dr. Eduardo Costa. In this course, you will have the opportunity to learn the original technique, developed by Dr. Almir Naco, creator of the bioplasty technique and perfected by Dr. Costa. It is essential to understand that it is not enough to just apply the product, but to know how to evaluate each case individually, as there are several variations of format, anatomy, and genetics in different patients. You'll learn to evaluate each case, make the markings correctly, and most importantly, distribute the syringes intelligently, so that the result is achieved and customer satisfaction is complete. The most common indications for gluteobioplasty are increasing volume, correcting the trochanteric depression, improve sagging, correcting irregular hip contours, and increasing the hip. It is worth mentioning that this is the first and most complete online course on gluteobioplasty, and the only one in the world where the student learns to handle the PMMA application gun. It is also important to note that we will encounter patients from unsuccessful postoperative lipografting, patients who removed silicone prostheses due to complications or adverse reactions to the prostheses, patients with physiological or pathological lipodystrophy, patients with trauma or injectable sequels, patients after bariatric surgery, feminization of the hip in transsexual patients, among other situations. Those are more advanced indications, where the professional must be a little more experienced and secure. We have an advanced course for those cases. Please check at the end of the course for more information. After all that, the next step is our hands-on course, where you will have the opportunity to perform the procedure under the supervision of Dr. Costa and have greater confidence to follow up and do the procedure safely in your clinic. I hope you enjoy this experience. Thank you for your presence. Learn a lot and see you soon. This course was created by Dr. Eduardo Costa, a Brazilian physician specialized in aesthetic medicine. Dr. Costa developed a methodology to teach minimally invasive techniques using fillers and microcannulas with a unique kind of application gun. The technique is called bioplasty and was originally created by Dr. Almir Naco, a Brazilian plastic surgeon. Dr. Costa has been a spokesman for LineaSafe and Lebon Laboratories since 2012. LineaSafe is the purest PMMA produced in Brazil. Dr. Costa has collaborated in research on PMMA at the Federal University of Goiás since 2008 and teaches courses and workshops on bioplasty in Brazil and Latin America since 2014. Dr. Costa is also a certified educator at the International Academy of Aesthetics in Beverly Hills, California since early 2016 and is the director of the bioplasty training program at the American Association of Aesthetic Medicine and Surgery. The definition of bioplasty, according to its creator Dr. Almir Naco, is plastic without surgery, performed by implanting biomaterials in deep levels using a minimally invasive technique. The first injectable implant containing polymethyl methacrylate microspheres occurred in 1988 in Germany. The product used was Artecol, using a bovine collagen vehicle. Over the years, other brands have been developed and the product is currently on its third generation. In Brazil, the most used product and the safest according to scientific evidence and research is LineaSafe, produced by the Lebon Laboratory since 2011. LineaSafe currently can also be purchased in Mexico. Belafil is the product used in the United States, but its vehicle is made of bovine collagen. For some years, between 2004 and 2006, PMMA was also produced in Brazil by handling pharmacies. It did not last long. Pharmacies were prohibited to manipulate the product as soon as there was evidence that the quality and the results of their products were not good, causing several complications and tarnishing the product's reputation. Most professionals opposed to the use of PMMA base their opinion on the complications caused during this time. They do not take into account that Anvisa's rules for the product production are extremely strict today. The American Society of Plastic Surgeons has decided that the use of PMMA is regulated and unimpeded. For information purposes, we'll take a look at a microscopic analysis of the PMMA brands sold in Brazil. This research was carried out at the Federal University of Goiás in July 2018. In the case of biosymmetric 30% produced by MTC Medical, the sample presents 82.1% of the particles with diameters distributed in the range between 35 to 40 micrometers, with an average value of 38 plus or minus 2 micrometers. Considering all measured particles, the general average is 38 plus or minus 3 micrometers. The lines show the size ranges, number of particles per range, and their respective percentages in relation to the total. Note the variation in the size of the particles and the large number of them with different sizes. In this graph, you can see the difference in particle size distribution. In the images, we can see the PMMA particles from the sample of the biosymmetric 30% sample, with increases of 1500 times and 3500 times. Note that the particles had a regular spherical morphology and surface roughness. For LineaSafe 30% from the Le Bon laboratory, the sample presents 89.4% of the particles with diameters distributed in the range between 39 to 42 micrometers, with an average value of 40 plus or minus 1 micrometers. Considering all measured particles, the general average is 40 plus or minus 2 micrometers. Note that the difference in particle distribution over the size range is considerably smaller in LineaSafe. This means that the vast majority of particles, 98.3% to be exact, are very similar in size. Note that the LineaSafe distribution graph has considerably more particles around 40 micrometers and less particles scattered in smaller sizes. PMMA particles from LineaSafe 30% sample with increases of 1500 and 3500. The particles had a morphology with regular contours with no surface roughness. Metaderm from Brazil Pharma was discontinued sometime after this research, but it serves us for comparison. The sample presents 78.7% of particles with diameters distributed in the range between 37 to 42 micrometers, with an average value of 39 plus or minus 2 micrometers. Considering all the measured particles, the general average is 39 plus or minus 3 micrometers. Note the large variation in particle size, as well as the large amount of particles of non-ideal sizes. In this graph, we can better visualize the difference in the amount of particles of different sizes. Metaderm 30% particles showed regular spherical morphology and surface roughness. Now, notice the difference in roughness between the three products. According to medical literature, an irregular or rough surface induces chronic granulomatous inflammation by increasing the adhesion and fusion of macrophages. A smooth surface minimizes the adhesion of macrophages and the formation of giant foreign body cells. To which we can conclude that the smoother the product surface, the better. Before we start, let's talk a little bit about the Uniform Microspheres Smooth Surface Technology, also known as UMSS. This technology is present in LineaSafe, produced by Le Bon Laboratory. The first injectable implant containing polymethyl methacrylate microspheres, PMMA, was developed in Germany in 1988. Continuous improvements have resulted in the third and current generation of implants, and the LineaSafe we know today. The first generation proved to be effective, although it provoked some adverse reactions. Most of these reactions were caused by nodules at the injection sites, occasionally associated with an inflammatory response. Subsequent investigations led to the conclusion that there is a specific limit on the diameter of the PMMA microspheres, which is essential to prevent phagocytosis by macrophages and the formation of giant cells, causing granulomatous inflammation. Research suggests that PMMA microspheres smaller than 20 microns in diameter may trigger a foreign body reaction. LineaSafe took the lessons learned during these 2 decades and using the UMSS technology obtained with great precision an ideal diameter of the PMMA particles, with an average of 40 micrometers. LineaSafe is composed of highly purified PMMA microspheres suspended in a hydrogel vehicle of organic synthesis, non-allergic. LineaSafe is a state-of-the-art product with its own technology, which gives the microspheres a smooth and impurity-free surface, with an average diameter of 40 micrometers, guaranteeing excellent results for doctors and patient satisfaction. In biocompatibility studies, the mutagenesis analysis did not introduce mutations. In addition, toxicological analysis showed no toxic effect or skin irritation. The test of thermal sensitization in guinea pigs resulted in no sensitizer. The systemic toxicity test resulted in no toxicity, and the animals tested did not show clinical signs of toxicity or hematological, biochemical, and histopathological changes. If the biomaterial is less than 20 micrometers, phagocytic and possible migration occurs. If the biomaterial is between 20 and 30 micrometers, phagocytic and chronic inflammation occurs. Biomaterials larger than 30 micrometers, such as Artefil, Artecol, and LineaSafe, are safe for application. Because it has methyl in the alpha position, PMMA is considered correlate-free from any pharmacological action. It does not generate any degraded products circulating in the bloodstream, thus there is no maximum dosage of toxicity. LineaSafe 2% 1 ml is used to correct fine wrinkles, depressions in the lower eyelid, enlarged lips, and offers the possibility of using a needle in the intradermal level. LineaSafe 10% 1 ml, on the other hand, is used to correct grooves and mobile areas, nasogenian groove, nasojugal groove, lip contour, back of hands, earlobe, and genitalia. LineaSafe 30% 1 ml is used in areas on the bone surface, such as the cheekbones, zygomatics, chin, nose, and jawline. And finally, LineaSafe 30% 3 ml is the product used in body bioplasty, on the gluteus, thighs, calves, chest, biceps, and triceps. The PMMA LineaSafe has Anvisa certification. Anvisa can be considered the Brazilian FDA. The product's risk rating is grade 3, high risk. In other words, it must be used in a responsible manner by a trained professional with the correct instruments and in a properly cleaned and regulated clinic. In the United States, PMMA was approved by the FDA in 2006. Let's do a brief recap of the anatomy of the gluteus. The result of the gluteal bioplasty is due to the projection of the musculature as the product is applied between the bone and the muscle. It is also important to be aware of innervation. Vascularization must also be observed. Now let's talk a little bit about the types of filler that can be used to correct the gluteus. LineaSafe 10% 1 ml is used for small superficial corrections. LineaSafe in 30% 3 ml concentration is the ideal product to increase the volume of the gluteal region in deep levels. As with any aesthetic procedure, there are indications and contraindications that we must observe. The most common and sought-after indications for gluteal bioplasty are increase of volume. In Brazil, the great demand is for size. The so-called volumization is the desire of the vast majority of patients who seek gluteal bioplasty. Let's take a closer look at how to approach each case later in this course. Correction of trochanteric depression is performed by increasing the amplitude of the hip by projecting the muscles to the side. Another very common case is the correction of irregularities in the contour of the gluteus. Gluteal bioplasty with PMMA stimulates the production of collagen and elastin, improving muscle tone and repositioning the musculature that has undergone pitosis. Note the difference in the contour in this case. In cases of depression in the skin, such as cellulitis, sequels of injectables, trauma, or others, it may be necessary to perform a subcision to detach the skin before filling. This is another case of skin depression. Notice the difference over 90 days. Cases of sequels of lipografting are also common. One must always evaluate the need for aspiration of the grafted fat, in order to regularize the contour and so that the muscular projection provides a smooth surface. In cases of physiological asymmetries, differences must be observed carefully, and it is essential to use a common sense when deciding to place different amounts on each side. Eventually, we come across patients who had complications of silicone prostheses, such as capsular contraction, rupture of the prosthesis, whether spontaneous or due to trauma, infection, seroma formation, displacement of the prosthesis to the superficial level, etc. Usually, the prostheses are removed and the patient wants a second option of technique to recover the volume. It is recommended to perform control magnetic resonance after the prosthesis is removed, another MRI 3 months after, and from that, decide whether to perform the biomaterial implant or not. Now, let's look at some contraindications for gluteal bioplasty. Avoid performing the procedure on patients who already have silicone prosthesis, due to the risk of perforation of the prosthesis. Remember that if the patient wants to remove the prosthesis, the gluteal bioplasty is a good option to recover the volume. Perform the MRI after removing the prosthesis, do another MRI 3 months later, and from there decide if the gluteal bioplasty is recommended. Patients with implants of substances not allowed by Anvisa, such as industrial silicone, ADE, or other products for horses, mineral eye, etc., tend to be complicated. Avoid performing procedures on these patients as much as possible. Mixing the products can cause several complications. Another contraindication is of patients with autoimmune or collagenous diseases, due to the high risk of triggering generalized inflammation or manifestation of the disease. Do not perform the procedure on patients with an infectious process at the implant site, with a history of chronic sciatica, or in patients with muscle diseases. The face-to-face consultation will most likely be your first contact with patients. This step is crucial for the patient to decide whether or not to perform the procedure and, of course, to determine whether the procedure is indicated for that case. Start with the anamnesis, proceed to the physical exam, and verifying that there is an indication, proceed to the definition of the amount of product to be used. Let's talk about the anamnesis. Start by checking the patient's primary complaint. In the case of gluteal bioplasty, the most common are correction of trochanteric depression, correction of depressions in the skin, irregularities in the contour, or even correction of flaccidity. Correction of ptosis, physiological symmetries, sequels of silicone prosthesis, and feminization of the hip are also common complaints. Assessing family history is also essential to avoid complications and possible annoyances. Again, avoid performing the procedure in cases of autoimmune or chronic inflammatory diseases. Get to know the family biotype in the gluteal region. Find out about allergies to medications, anesthetics, food, etc. Surgical background is also important. If the patient has already done some kind of filling, request a magnetic resonance imaging of the hip and identify possible problems and impediments to perform a new application. Finally, let's go to the physical examination, essential part to perform the procedure. Start by assessing the musculature. It is very important to define the amount of product to be used. Observe the muscle tone and limits around the gluteus. Evaluate localized fats, cellulitis, sagging, and pre-existing asymmetries. Identify previous fillers, nodules, new vascularization, and skin tightening. If you find something, ask what type of substance was used. Now, let's talk about the photographic documentation. It is essential for us to compare the results after the procedure. When working with aesthetics, we know how important it is that the before and after pictures of a patient are part of the patient's profile. Photos are essential to prevent arguments and, of course, to protect yourself in some cases. The proper environment for making photographic documentation involves several aspects. Paying attention to the following items will make your photos incredibly better. This will be a huge differential of choice when the patient is deciding with which professional to perform the procedure. Lighting. Lighting is one of the most important aspects of photography and must be really well observed so that your images are of good quality. Even if you don't have such a powerful camera, it is advisable to have white light on the ceiling and, even better, if the light is directed to the patient. Avoid standing in front of the light or using anything that causes shadow in the image. The better the lighting, the better the results of your photos will be. The background is also very important. In addition to demonstrating organization, having a neutral background in the photo helps so that it is not noticed. That's right, the background is something you shouldn't see in a medical chart photo. It is just there for professionals and patients to compare results in a much more practical and clean way. Use a dark blue background for lighter skin and a white background for darker skin. If you need a white background, you have the option to use the white of the wall simply by lifting the blind. Now, the camera. Use a digital camera with the highest resolution possible. State-of-the-art cell phones are capable of taking excellent photographs. Always try to use a tripod so your photos will not be blurred and be better positioned. Never use flash. The light should be good enough that you don't have to. When using a camera, make sure the card has enough memory available and the battery is charged. Try to use cameras with image stabilizer. The patient's positioning is also essential so that you can compare the before and after photos. Remember to take pictures of the back, 45 and 90 degrees on both sides. It is advisable, in fact really important, that you have a mat with the markings so that your patient can step on and position themselves at the correct angles. This will make your photos from before and after have exactly the same position. In the same way the patient has a mat, the professional taking the photo must have a mark on the floor so that the photos are always the same distance. Try to define a standard position or distance and never change. It is important that the photos are taken from the same height. For this, having a fixed tripod really helps. Tripods are excellent for preventing variations in arm movement. You can also have a tripod fixed on the floor, so the camera never changes distance. If you do not have a mat and a standard positioning, never approach the patient to photograph. Use the zoom, but keep in mind that zooming increases instability and can result in blurry pictures. If you plan to zoom, try to use a tripod. Proper positioning makes it very easy to set up the before and after comparison. You have already seen that positioning is important. Try to stay between 1 meter and 1.5 meters away. Once taken, the photos should look like these. Storing photos is extremely important to streamline documentation and search for results. It is good to have a basic understanding of how computers work and how to create folders and subfolders. Organizing your files by procedures and complaints is often a hand when it comes to showing the results already achieved to other patients. The more specific and organized you are, the easier it will be for you to find what you're looking for. Always have a backup off of your computer. It is recommended that you have a backup on another physical disk and at least one backup in the cloud. iCloud, Google Drive, and Dropbox are really useful for that. Don't be afraid to pay for more storage if you need to. It will be worth every penny if you ever need it. For the results of the procedure to be properly compared, the before and after photos are really important. They show you and the patient what has changed and what may need retouching. When assembling the photos, try to create guidelines on the patient's gluteus. This will make it easier if you need to resize or straighten the angle by a few degrees. Remember to resize the images so that they are the same size and are vertically aligned. For the guidelines, try to use physical characteristics, tattoos, birthmarks, or other aspects presenting both photos. You understand better when making your own comparison. If you have a high demand for patients, it is worthwhile to hire a professional who will do that for you. Now we go to the instruments necessary for the gluteal bioplasty. The support table is essential so that microcannulas do not touch anything and remain clean, in addition to providing the adequate place for organizing your instruments. The application gun is one of the great secrets of bioplasty. The use of the gun allows greater control to the professional performing the procedure. Each click of the gun releases exactly the same amount of product, so that placing the planned amount of product is much simpler, more practical, and safer. In addition, targeting and application are considerably easier with the gun. Marking molds are used to guide the application of the product. We will talk a little more about the markup in the next slides. We recommend to use a white marking pen or pencil to mark the correct location of the application. Microcannulas are essential when performing applications in deep levels. They prevent the rupture of the vessels and make the procedure safe and easy to reproduce. Did you not understand well? So let's explain better. Why are microcannulas so important in bioplasty? The blunt tip prevents rupture of vessels and embolization or trauma to the nerves. This is essential when working on deep levels. In these animations, you can see how the microcannula differs from the needle for applications in deep levels. Note that if a needle is used, it can disrupt vessels, causing bleeding and bruising. Microcannulas do not break the vessels, and biomaterials can be safely placed at the correct level. The use of needles can cause rupture of vessels and other complications. The poker cable is used to attach the needle that makes the puncture, the small hole made to introduce the microcannula. Its use avoids contact with the needle and provides greater precision for making the hole. And the application technique. What's the secret? The application is done by retroinjection and only when the microcannula is in the correct level. In this image, we can see the application levels. The level we should never apply biomaterials to is the fat, because in this level there is no connective tissue to accommodate biomaterials and stimulate collagen. Bioplasty is performed between muscle and bone in more than 80% of the applications. When doing the syringe distribution, the application follows the logic of centrifugal force. The amount of products to be used depends on the musculature of each patient. The average that is placed in a safe application is around 150 to 180 ml on each side, and can reach 240 ml on each side in larger muscles. The doctor is the one responsible for deciding the amount of product to be used, not the patient. When marking, we draw vectors, starting from the intersection of the vertical line with the horizontal line, towards the end of the upper lateral and medial, lower lateral and medial quadrants. For example, in the application of 180 ml on each side, the total is 360 ml. One syringe is 3 ml. 360 ml divided in 8 quarters is 45 ml per quadrant, so 15 syringes will be applied per quadrant, for a total of 45 ml per quadrant. The sum of the 4 quadrants results in 180 ml applied to that buttock. Each quadrant has 5 vectors. One syringe is applied per vector, going back and forth 3 times for a total of 15 syringes. The average amount of product used in gluteal bioplasty to obtain good results both in volume and hip correction is 180 ml on each side, which divided by 8 quadrants, 4 on each side, is 15 syringes of 3 ml per quadrant, or 45 ml per quadrant. When this calculation is not accurate and 4 syringes are left, as in the case of applying 210 ml on each side, the surplus is usually placed on the smallest part. Always remember to evaluate before setting the number of syringes per quadrant. Check the symmetry of the muscle, if there are differences in the hip contour, if there is any difference in volume between the upper and lower thirds, and if there are differences between the medial and lateral thirds. Remember that any and all asymmetry or irregularity should be discussed with the patient before the procedure, so that there is no dissatisfaction with the results. Eventually, there is no way to guess the exact amount to be placed on the smaller side so that it is symmetrical, and a second application may be necessary to further improve the result. Make this clear to the patient. Often the presence of fat located in the region of the flanks and breeches creates a false impression that the patient has depressions on the sides of the hips, the famous trochanteric depression. In fact, the false depression is generated due to the fat that is projected in those regions, thus generating different heights, compromising the natural contour of the hips, leaving patients confused when looking in the mirror, in addition to inducing them to think that the problem is the unevenness caused by the localized fat. Filling this gap is a mistake. The correct thing to do is to suck out the localized fats to regularize the hip contour and only later perform the bioplasty. The subcision is necessary when the patient has grade 3 or 4 cellulitis, where the skin is retracted with the fibrous bundles in the subcutaneous tissues, creating depressions in the skin. Depending on the degree of the adhesion and retraction of the skin, it is necessary to detach the skin. For this, you can use a tool such as, for example, a cutting blade, but be careful, as it can produce bleeding and bruising. In these cases, filling is done at a different time, on a different date. You can also use a non-cutting duckbill microcannula, which traumatizes less, prevents bleeding, and often already allows the association with filling to regulate the depression or irregularity of the skin. Before the mini lipo, after the mini lipo, and after the bioplasty. Now for the practical part, defining quantities of syringes per quadrant, based on the different volumes and formats present in the gluteus. In a symmetrical musculature, we divide the number of syringes by 8 and apply the same amount per quadrant. For an asymmetrical musculature, with a difference between the upper and lower thirds, a larger amount is to be applied where the volume is smaller. This also applies to cases of ptosis, where the upper quadrants need more projection for muscle repositioning. This is based on common sense and experience. This amount on average ranges from 2 to 5 syringes. When the upper third is smaller than the lower third, we usually call it pear butt. On the case of the inverted pear butt, we apply more syringes on the lower third, where the volume is smaller. For asymmetrical musculature with a difference between medial and lateral quadrants, a larger amount should be estimated to be applied where the volume is smaller. In the case of trochanteric depression, where there is a need for greater muscle projection to correct the depression on the sides and regularize the hip contour. Note that more syringes must be directed to the upper and lower outer quadrants for balance and naturalness in the final result. Always remember to fill out the patient's form. Write the amount of product applied on each side and stick the product identification seal. These measures can avoid future hassles. To prepare the patient, wear a disposable cap and apron. Marking. This is one of the most important parts of the gluteobioplasty. Using the ruler, we draw a line of approximately 7 centimeters. Then we place the gluteal marking mold and trace its outline. Connect the horizontal and vertical marks and number the quadrants 1, 2, 3, and 4. Repeat the process on the other side. Remember that the mold can be moved up, down, or even from side to side, according to the need for correct position on each patient.
The anesthesia used in gluteal bioplasty is Klein's solution. The formula is as follows: 250 ml of saline 0.9%, 2.5 ml 8.4% sodium bicarbonate, 0.5% of adrenaline, and 7 mg per kilogram of 2% lidocaine. For example, let's do the calculation for a 65 kilos patient. 65 times 7 mg of lidocaine, that's 450 mg. Making a simple rule of 3, we arrive at the result of 22.5 ml of lidocaine. Reviewing the application level. The PMMA is applied between the bone and the muscle. With the application in this plane, it projects the muscle and generates the effect of volumizing and correcting the contour. It is time to understand better about the application of the product. As we saw earlier, we do the marking and define the quadrants. In this case, we will apply 180 ml on each side. That's 15 syringes per quadrant. We apply the first 5 to the drawn vectors. Notice that the 6th vector is in the same location as the 5th. That means that in the lines between the quadrants, more product is applied, forming a kind of a tent. Observing this animation, the difference between the before and after of a gluteus bioplasty procedure. After the procedure is finished, the post-procedure guidelines should be clear to the patient. On the way home hotel, the patient should lie on her stomach on the back seat. The patient must spend the initial 3 days on absolute rest, in bed, lying face down, getting up just to go to the bathroom and shower, always with someone's help, and they should avoid steps and stairs. From days 4 to 7, the rest continues, but the patient can now sit, supported on her thighs for short periods, up to an hour, no hiking or walking. On the 8th day, life returns to normal, and the patient is free to work, study, except physical exercises. With 15 days, the patient is already free to exercise and sunbathe. Make it clear that, in doubt, they should contact the clinic. Although it does not cause rejection due to the fact that it is biocompatible, as in any other aesthetic procedure, adverse reactions, complications, and intercurrents can occur. Let's understand a little better about them. Subcutaneous nodules can occur by refluxing the product towards the surface. They usually occur due to the patient's lack of rest, when they sit or walk before the deadlines set in the post-procedure guidelines. Seromas are common in patients who have removed prostheses. They can also occur superficially in patients with predisposition. Abscesses occur due to bacterial infection. Skin atrophy can occur after intralesional infiltration of triamcinolone into subcutaneous nodules. The macrophage, which is between 15 and 25 micrometers, does not recognize whether the material is to be phagocytated is 1 mm, 1 cm, or more in diameter, as well as if the volume is 2 ml, 200 ml, or even greater. Another myth in relation to the PMMA is that it migrates. No, there is no migration. Bioplasty promotes re-engineering that increases muscle support through the formation of collagen. Each PMMA microsphere is individually encapsulated by a microprosthesis and kept in place without generating encapsular contracture. When applying PMMA, our body's natural reaction is to protect itself. The biostimulating action of PMMA makes our body cover the foreign particle with collagen and fibrosis, so a layer is formed around each polymer. Most of this process takes place over around 60 days. For example, when applying PMMA to the gluteus, the volume increases due to the amount of product, and over the next around 60 days, the body produces collagen to encapsulate the PMMA polymers. This natural reaction increases the volume even more, so the result is not immediate. In short, on the day of the procedure, the volume increases according to the amount of product applied, and over the next 60 days, the collagen creation process increases the volume even more, without any migration. The end result is therefore the sum of the amount of PMMA applied with the formation of collagen around the PMMA polymers. Now let's address an essential aspect of gluteal bioplasty: rest after the procedure. In the first 3 days, the patient should lie on her stomach, prone or on her side. Just go to the bathroom or eat. Instruct the patient to always have a companion for trips to the bathroom and to eat. Postural hypotension and risk of loss of consciousness are common. It is recommended that the patient flexes and do extension movements of the leg every hour to favor the venous return that is slower due to the little ambulation. Calf and posterior thigh muscles massages are also interesting to provide greater comfort to the patient. From the 4th day onwards, the patient can start to sit, supporting on the posterior thigh muscles, avoiding supporting the lower part of the gluteus. What medications are recommended after gluteal bioplasty? Right after the procedure, use an injectable depot corticosteroid. If the patient feels any pain, commonly used painkillers will do the job. It is common among patients looking for gluteal bioplasty to be interested in physical activities. It is recommended to start physical activities in the gluteal region only 2 weeks after the procedure, respecting the limits of each person. There is no problem in performing torso and arm exercises before this period, if the patient feels able to sit and stand without discomfort. After 15 days, the patient can start with a light load, increasing gradually, so there is no unwanted contractures, inflammation, and pain. Scheduled return. In addition to the post-procedure guidelines, it is important that the patient is aware of the scheduled returns. Make sure you have a cell phone number that you can speak to patients, different from your personal number. Exchange messages, check if everything's okay. After 24 hours, call the patient and check if it's going well. Check the level of pain, if there's any discomfort, and, if necessary, visit the patient at home. Schedule the first return for 7 days. Check that everything is fine and ask to schedule the return for photographic documentation within 60 to 90 days after the procedure. In 90 days, the results should be closer to the final. When the desired volume or corrections in the contour are not reached, complementations or touch-ups may be necessary. When returning for photographic documentation, pay close attention if there is any asymmetry, if it is necessary to fill in any cellulitis and/or do a subcision. Liposuction of flanks and breeches may also be necessary in some cases. Remember, you must wait at least 60 to 90 days for any touch-up or complementation to be carried out. Only apply more product after stabilizing the material placed in the first application, especially in the case of deep application. Now, it's time to analyze some clinical cases of gluteal bioplasty. Congratulations on completing the online course on gluteobioplasty. I hope you have clarified your doubts. Now, the next step in your preparation is a hands-on course. Please contact us for more information. Wish you the best.